This episode of Common Health is brought to you by Reg Lantern. Reg Lantern is a straightforward and easily understandable software platform built to assist community health centers in staying compliant so they can focus on serving their patients rather than paperwork. For health centers that are serious about achieving, managing, and maintaining compliance, Reg Lantern provides a comprehensive approach and is an affordable and valuable solution. Reg Lantern can help your health center. Contact them today at reglantern.com. That's REG, as in regulations, lantern.com. For special discounts, mention that you heard about Reg Lantern on the Common Health podcast.
Hey there, and welcome to Common Health from the Virginia Community Healthcare Association, or VCHA, or what we're also known as is VACHA. I'm Tracy Douglas Wheeler, VACHA's Chief Executive Officer. On Common Health, we're here amplifying the voices of community health, both those who give care and those who need it. And we today are going to be talking about services that are provided here in the Commonwealth of Virginia, more specifically from organizations known as federally qualified health centers, as well as lookalikes. And they're really where you can go in and get healthcare services. And today, the title of our podcast is called Off the Reservation and Onto the Island. And that's because we've got today a guest by the name of Matt Clay. And Matt is the CEO of Eastern Shore Rural Health. And that is one of 28 community health centers here in the state of Virginia. And Eastern Shore is really on the banks, the waters of Virginia. For those of you who don't know, Virginia encompasses not only rural and urban settings, but it also encompasses the Eastern Shore. And so that being said, we're going to talk today with Matt. But before we talk a little bit about the services that Matt's organization provides, we're going to take a step back and actually talk about who Matt is. Matt actually has an interesting history. His heritage is quite interesting. And I will tell you, for our listeners, Matt and I know each other. So this isn't the first time that he and I are meeting for this interview, but we have known each other for quite some time. And when I learned at the time that Matt was a Native American Indian, I was quite struck, because when I have typically thought of a Native American Indian, right, it's someone that usually has a bit of a brown skin and jet black hair, and very beautiful jet black hair. But when you see Matt Clay, Matt does not look like that. And so when at that point, when he had shared about his heritage, I said, well, I've got to learn a little bit more. And so that's why we've titled this podcast as Off the Reservation and Onto the Island, because we're going to talk just a little bit about Matt's heritage and where he comes from. And Matt, I just want to let you know that I did a little bit of research before we brought you on, so that I can kind of sound a little bit intelligent when we talk a little bit about your heritage. So I can remember when we talked, you had shared with me that you are known as a Potawatomi Indian. Did I say that correct? Okay. And when in doing some of my research, I understand that Potawatomi Indians are mostly up in the Michigan area, and they go a little bit into Indiana and Wisconsin, and a little bit into Illinois. So talk to me a little bit about who are the Potawatomi Indians.
Well, Tracy, thank you for inviting me here today. I appreciate it. Our heritage has been around, since the existence of the United States, as long as history has been known. We are known as the Great Lakes Tribes. We surround the Great Lakes, and we have there's 9 different bands that make up the Potawatomi Nation. And we are one of 3 tribes that are called the Fire Keepers, Keepers of the Fire. So it's it's pretty unique. It's a great culture to be part of, and there's a lot of history there that I've learned from our tribe. But we are one of 3 tribes that are in 2 different states. Most tribes are in a single state. We're in southern Michigan and northern Indiana. And to give a kind of a synopsis of how the tribe was formulated to its current terms of the Pokagon Band of Potawatomi, and Leopold Pokagon was our founding father, so to speak, and that's how we got the name. And back in the 1800s, early 1800s, when a lot of tribes were being forced to march out west, there were some Potawatomi nations that were doing that as well. And many people are familiar with the Trail of Tears. The Potawatomi Nation went on what was called the Trail of Death. And it was very similar to that, but was smaller scale. And our Leopold Pokagon at the time, he walked from the very southwest corner of Michigan, northern Indiana, all the way to Detroit, which is about 200-mile walk, to meet with the Archdiocese of the Catholic Church to work with them to try to get the federal government at the time to allow them to stay on their land. So our land in southwest Michigan, northern Indiana, is the original area for the Potawatomi Nation and still stands today. In a brief history, and again, I don't do it justice like our language and culture folks do back in Michigan, but they worked so well with the Catholic Church that they were able to settle on this land, and the Catholic Church came out there and started putting churches, and Notre Dame sits on Potawatomi land, and that's how Notre Dame was founded. So it's a really neat story. As you can imagine, we have a lot of our elders are Catholics due to that relationship over the years. But it's, there's a lot of historical trauma too when you talk about the Potawatomi people and what has gone on. And some of our elders still remember this. Some of our elders were sent to boarding schools, were forced to change their names, were forced to cut their hair, couldn't speak the language. So that's very traumatizing for them. And when you sit down and talk with some of these elders, there's not very many of them around anymore, and listen to their story and listen to that fight to get to back where we are today. Our tribe is fortunate to have grown. We've done well. We now have 5,700 citizens of the Pokagon Band in Potawatomi, but there are thousands throughout the Potawatomi Nation. And some of the things they do is, we have powwows. We represent our culture. We do many things from basket weaving to making canoes to, we tap maple trees for sugar and syrup, and we call it sugar bushing, and it's great. And it's neat because it's happening right now this time of the year. So they will make hundreds and hundreds of gallons of maple syrup, and it's really neat to be part of that culture. But we look at our tribe, and there's some significant things that have happened. So and that's just a synopsis of who we are. But it's a great nation. It's a great community to be part of.
So, do you have a tribal name?
I do not. So there's a process that goes through being named from a tribal elder. And that's a significant process where you typically go out for 4 days into the woods and they name you based on, it's typically based from your father's side, but I do not. So
you are working over at Eastern Shore, but I think if I remember when you and I spoke, you actually came from a clinic that was on tribal land. Is that correct?
That is correct. So I'll give a kind of a quick lesson on reservations and trust land. So reservations were land that were given to us, and I say that loosely from the federal government because obviously we were here first. We are known as the First Nation. Mm-hmm. A trust land is land that we had to purchase and put back in trust through a federal agreement. But we were fortunate to have land put in trust, and we were allowed to govern ourselves. So we are our sovereign nation within Indiana and Michigan and have our own laws. We have our own court system, and they do things differently there as opposed to the states. Having said that, yes, I came from a health system on the tribe. And if I may, prior to that, I want people to know I'm not from a healthcare background. I started my career in education. And a couple years into my education, I got my master's degree in IT. and I wanted to be diversified in what I did. I became the tech coordinator for the district. And then when the economy started tanking in 08, 09, I was looking for other opportunities because education was a hard place to be. And during that time, I was allowed to work for our HR department with the tribe doing training and development. And at that time, I kind of knew that there was a potential opening for the director of IT position. So I got into that role. 7 months later, I became the director of IT. And I say all this because it leads up to how I got to where I'm at. But I, started that tenure as director of IT. I was having very good success, reorganized, restructured, took us from a very rough state in IT to one of the state-of-the-art. So much, in fact, that Microsoft flew a crew out to do a video on us and then changes in Indian country. So it was really significant. But during that time, I volunteered to be on our health board. I think it's important to be involved in very many groups. And as a citizen of the Pokagon Band, I wanted to be on our health board. So I got onto that board. I got nominated and selected by our tribal council. And so I was on the tribal health board there for the Pokagon Band for about a year and a half when they removed the director of health services, which was a friend of mine and coworker. And that same day, I became chair of the health board. So it was a unique role I was put in, and I would say I was much more in the weeds than what you typically would be in that role. So it was challenging. They tried to fill that for about a year, couldn't find somebody to fill that role, and then the tribal chairman and the government manager at the time came to me and said, "We would like you to take and run our tribal health center." And I kind of laughed. I said, "Yeah, I don't want that job. I didn't apply for that job. I have no desire to take that job."
Yeah.
And they leaned on me a little bit. But I said, "I tell you what," I said, "you give me 90 days, keep my job open in IT, and let's see where it goes." So we started out in a Sears brick building, the old Sears brick buildings. It was like 4,500 square feet. We had 3 exam rooms, 2 of which did not have running water. So it was not desirable, to say the least. And our behavioral health was across the street. And well, I say across the street, it was a state highway, so people had to walk back and forth. It wasn't safe. And it was challenging. So I worked with tribal council, convinced them to build a 37,000 square foot state-of-the-art healthcare facility. At that time, we saw there was a need for dental, so we added dental at that time. We added a wellness center. And besides the new facility, what we really did, we implemented trust, and there was a lot of trust lacking from previous, people running the centers. And also as a Native American, as you can imagine, there's a lot of historical trauma and a lot of distrust. So it took some time to do that. So we moved into that state-of-the-art facility and, had great opportunities to do many, many things. And if you want me to continue talking about that, I'd be more than glad to on how we got to that.
You have taken that experience, right, running that tribal health center, and you are now in the Commonwealth of Virginia on the Eastern Shore, and you're the CEO of a health center there. Now, the name of your health center is Eastern Shore Rural Health. Why is it called Eastern Shore Rural Health?
So Eastern Shore Rural Health, and I'll tell you why. It was created July 19th in 1976 because there was a need here on the shore. So kind of for some people to have a picture, a visual, we do not touch Virginia. We touch Maryland. We have 2 counties here that extend down. It's a peninsula, part of the Delmarva Peninsula. And I had to educate myself because it's Delaware, Maryland, and Virginia, hence the word Delmarva. But it was started because there was a need 45 years ago. And it was started with 2 providers, 2 nurses, 2 front desk people, and 1 director at that time. So, and one of the unique things is one of our board members, Dr. Art Fournier, was one of those 2 providers. So it's kind of neat to hear the history lesson from him. And he moved on and went to Miami and has since now come back about the last 12 years and has served on our board for the last 9 years. So it's a really neat and it's grown. We've grown from that 7 people to now over 300 team members here at Eastern Shore Rural Health.
But Eastern Shore Rural Health is not a tribal health center. What kind of health center is Eastern Shore Rural Health?
We are a federally qualified health center like the other 27 in the Commonwealth, and we provide a ton of services here. And the shore is very tight knit community. So I will say it's very similar to what we had at the tribe. If you live in Richmond or if you live in some of the bigger communities, it's not the same as here on the shore. And I tell people we've been here going on 17 months. This is still small town America. This is a great place to raise a family. And that was one of the things that drew us to come here. But it is very unique. It's one of the most giving communities I've ever been part of. But it's and with that, we service probably about 70% of the people here on the shore. So I mean, we make a significant impact here on the shore.
What's unique about you? You use the word federally qualified health center. What makes a federally qualified health center so unique to its community?
So this is where I would say it's very, very similar to what I had at the tribe. We take care of a population of people that are underserved, that don't have other means to health care. We try to change their lives. And that's exactly what we did at the tribe. That's exactly what we're doing here at Eastern Shore Rural Health. We are giving health care to people that don't have the opportunity. We're removing barriers for those people so they can get access like anybody else. And they deserve that access, just like our people at the tribe, our people here in our community deserve that same access.
It's interesting because I heard you use the words in describing your patients there and the Eastern Shore citizens as small town America. And that really is the theme of our podcast. It really is about taking common voices from common people, right? And so that said, tell us a little bit about your patients. Who are they? What do they think? How important is their health care to them? Yeah, you talked about all these great things that Eastern Shore Rural Health brings to them and offers them, but talk to us a little bit about who they are and what their perspectives are there on the Eastern Shore of Virginia.
So there's a variety of people here on the shore. We have watermen that go out and get clams and oysters and do that. We have a lot of agriculture here. So we have migrant workers, seasonal workers. We have a large Creole population here on the shore. So we're very diversified, and we have translators to speak all those different languages, remove those barriers. But it's, and we have a lot of people in between. And now we're starting to see some transient population coming from New York, New Jersey, as people are trying to get out of the big cities, especially during COVID. But so we have a wide range, and we have a unique payer mix with that as well. So we, regardless of payer mix, ability to pay, we treat everybody the same, and we get many, many letters for that. So again, we see the people that are very affluent have the houses on the water from the people that, and there's still people here on the shore that don't have running water. So we treat all those people the same, and we're making a difference in their lives. And to me, that's what it's all about. It's about service to our community. And we're doing that in a great way here, regardless of your socioeconomic status or your background or your race. And we treat everybody the same. We want to help everybody.
What kind of services do you offer to the population there on the Eastern Shore?
We start out primarily in medical, as I talked about earlier, with two doctors, and we now have roughly 30 medical providers. We have 15 dental providers, and we started behavioral health 2 years ago. And we have a lot of ancillary services that go along with that with outreach. We do pharmacy assistance. We do bridge toll programs. We do, some people may not be familiar with the Chesapeake Bay Bridge Tunnel, but we have we give around 8,000 passes annually to those people to go back and forth for referrals for services off the shore. So it's nice to be able to offer all those services. And I'm looking at other services we can provide to enhance the care that we provide here on the shore.
Matt, we did a show where we were speaking with Michael Jackson, who is the director of government and legislative affairs with the association that I believe that Eastern Shore Rural Health is a member of. And one of the things that we learned from him was this 340B pharmaceutical program, and that there's a lot of work going on at the government level to help protect that program. If that program were to go away, and you don't get the kind of protections that was shared with us on that show by Michael, What does that mean for Eastern Shore and your patients potentially?
The 340B program that was started, I believe, in the 90s is so impactful for what we do. It's hard to describe the impact if that were to go away. So I had the opportunity to speak with some representatives, some senators about this very topic, and it's a huge revenue generating stream for us, but much more than that, it allows us to open up service line and expand service lines. For example, behavior health is a area that does not pay well, but that's a highly needed service here on the shore as it is across the country. So that would be one area. But I think if you were to see that cut and reduce, you're going to see people shutting down centers. You're going to see us not be able to compete with other healthcare systems and paying our staff and our team members. And I think overall, you're going to see a ripple effect and an increase in like ER visits because people won't have the access that we provide in FQHCs, and I think that's significant.
Do you, by any chance, offer any kind of special services when it comes to their medications? What kind of things do you offer, or could you offer, or things that you might be thinking about in the very near future with regards to helping your patients around their medicines?
Yeah, so we have a pharmacy program. We have pharmacy staff that help provide those medications, much needed medications, because it doesn't do much good for a provider to write a prescription for something and the patient not be able to get it. So we work with them. We try to get them discount programs, and we do not have a self-owned and operated pharmacy at this point. We are looking at that, and we are starting to move down that path. For a couple of reasons. One, to help increase access. Two, for integration. And three, we want to be able to generate some more revenue to help increase our program service line. So there's a lot of ways we can do that. But it's if you can't remove.
You're sitting in a very unique situation. You're a CEO of a federally qualified health center, an FQHC is what you call it. You've come from a tribal nation where you were running a health center up there. And you spoke about the importance of these kind of health centers for the communities and for the patients that they serve. As a CEO, sitting where you sit, what do you see for the future of health centers in general?
Well, I think, it's very important. I look at my role as the ultimate support person as a CEO. Really, I like to flip that pyramid upside down. And if I don't help people and support them, they won't have success. But I think healthcare in the long run, and as the CEO, we got to give a vision to our team on where we want to go. We got to get people to buy into the mission. And I think it's getting challenging because, we're losing providers, we're losing clinical support staff. So how do we get people to understand what they're doing is changing lives? And at the end of the day, that's why we are here, to change lives. And if we can continue to do that, I think healthcare will change dynamically. I think artificial intelligence is going to change things. There's a lot of new technologies. There's younger generations that want things differently than the older generations. Not right, wrong, or indifferent. Just they want something that's just not the norm. So there's going to be a lot of unique things, and we have to be able to adapt and be agile to meet those needs. And as FQHC, we're part of a system that sees 30 million people across our country. I mean, there's no other health system that sees that many people. So it's significant impact.
What kind of role do hospitals play in this continuum of care, and as far as the work that health centers do in general?
It's vital. It's vital. It's a partnership. Everything we do should be a partnership. We partner with Community Service Board, CSB, here in the Commonwealth for the behavioral health side as well. But, for us here on the shore, there's one hospital, and if we don't have this hospital, people can't have births here. And we integrate with them. They have OB, we have pediatricians, so it's a great integration. But for example, the tribe, 78% of our citizen patients went to that hospital system. So we really integrate, and we do it here as well. We have a closed loop referral system. So anybody that goes to any hospital system, whether it's, the one here on the shore or off the shore, we want to make sure we're getting our patients back in, seen by their primary care providers, because we want to look at every aspect of healthcare. We want to close that loop. So those relationships are very, very important.
You had to move from Michigan to the Eastern Shore. So you go from it being very, very cold and a lot of snow to now you are surrounded by water, and I'm sure the scenery is quite beautiful. And then also your population was very different, right? You mostly cater to up in Michigan is, Indians. And so now you're on the Eastern Shore, and your population is very, very different. Can you talk to us a little bit about maybe a story? Give us an example of a story that you've experienced being there on the Eastern Shore. So it can either be a part of your health center or even outside of the health center. But I'd like to hear a little bit. Again, I want folks to really, our audience to really hear and know who the folks are that we see every day.
Sure. So if real quick, and this is kind of a joking, but I kid people because I tell them, I said, Michigan's the same as the shore. We were surrounded by three sides of water as well, but it's, that's about the only difference. Or the only likeness. I mean, it's, this year they've gotten hundreds of inches of snow in my hometown, and I certainly don't miss that. But, coming to the shore, it's hard to explain how tranquil it is here. And when you go across the Chesapeake Bay Bridge Tunnel into Virginia Beach and you come back, it's just like you just came to a different place, and the people here are so appreciative of what we have. And as I've shared with many people back home, we go out to the barrier islands, and we go out there and we relax, and it's a great community. And the people here on the shore, though, are so appreciative of what we have to offer them and what to give them. I have patients frequently reach out and tell us, thank you for that. Thank you for the service we provide. Thank you for that, setting up that appointment or scheduling that referral to the hospital system, or thank you for taking care of my grandmother, and it's so important to, just to help those people. And, I'm trying to think if there's any story that I have since I've been here, but, I don't know that I have any great story yet, except we're here to serve people on the shore, and change lives. And, and I've been involved in a lot of organizations since I've been here, and it's one of the most giving communities. And we give not only from our finances, but really of our time. And that's much more important, and to take care of people. The churches come together, the communities come together, and it's unique. So, the small towns here, there's only 44,000 people total on the shore. And these towns are not very big. So I'll give you an example. There was a Christmas parade in a town that you could drive through in about 15 seconds, but the parade lasts almost an hour because community members from all over up and down the shore come and participate. The same with the 4th of July parade and all these things. It's just really neat to see, how we do this and how it's such a giving community, and they appreciate the service they get here on the shore, but it is such a needed service. If we were to, lose the service on the shore, I don't know what people would do.
Because we are in interesting times, right, for the last couple of years from a healthcare perspective, we're going through and have continue to go through a pandemic. I'm curious, how has COVID changed the people on the shore? You've described them as such caring and giving people, but I'm really curious, has COVID changed them in any way? Have you all seen any different in the patients since COVID hit the Eastern Shore?
I think with everybody, it's been challenging. We're coming up 3 weeks from the anniversary of COVID for being here for 2 years, and I think that's changed everybody's lives. But one of the things is there's not a lot of internet service here on the shore. So to switch and transition to telehealth and telemedicine was challenging, to say the least. So that was a challenge, the adoption of bringing people up, doing a drive-through visit as opposed to an in-person visit because of COVID and the testing and all that. And through all that, working with the health department and the hospital and doing all these things, the people here on the shore, it's almost like their resolve has grown because of the uniqueness here on the shore and the appreciation. And I can tell you, they really appreciate what we've done. There's been some large factories here on the shore that had high rates of COVID, so that threw us for a loop for a while, and we got those under control. But for a long period, we were the lowest two of the lowest counties with COVID positivity rate. But it's it's a great resolve here on the shore with the people we have, and And COVID was significant, and it still is significant in the impacts we have from healthcare workers to people in the schools. The same story we hear everywhere else, but it is challenging. But what I see the most and what I hear here as opposed to other places is the resolve and the willingness to continue to move forward and really grow. It goes back to that small town, that small America feel.
Apparently, in order, a community health center has to have 51% or a large portion of their board members have to be consumers of the medical services at the health center. Is that the case? And if so, talk to us a little bit about why that's important to have that large of a percentage of your board members to be consumers of the health center.
So, yeah, one of the requirements for FQHC is that you got to have between 9 and 25 board members and 51% of them being consumer members. My goal is to get to 100% when we're very close to that for our board. But it's vital because we want that perspective. We want them to know the patient's perspective, and that input on our board level is significant because they live it day in and day out when they come to our centers. And it's again, that's why the tribal environment is FQHC lookalike. It's very similar there as well. So we want that input, and it's one thing to do these different charrettes or different meetings with people and talk with them, but it's another thing when they're in your centers and they're on your board, they're helping drive the direction we go from a high level, so that governance piece is important. And I will say our board is one of the best. That's what attracted me to come here to the shore, is we have a significant board here. They have a significant impact, and they have one of the most engaged boards I've ever seen. And it takes a lot of people. There's a lot of work that goes on to being on a board for FQHC.
Well, Matt, thank you. Really appreciate you taking the time to talk with us a little bit about some of the good work that the Eastern Shore Rural Health Center is doing. And we hope that we can bring you back in the future and talk some more about some of the other good, maybe additional things you had shared, that you've got some plans for some additional services that'll be coming down the pike. So we look forward to bringing you back and talking some more about what those things are and how it's been working out. So thank you for your time. And listeners, if you'd like to get more information around Eastern Shore Rural Health, please go to our website at vcha.org, and we'll be able to share with you around some of the work that Matt described in this podcast, as well as the folks of the Eastern Shore of Virginia. I want to thank my guests for joining us today, and thank you to all the listeners for tuning in to Common Health, brought to you by the Virginia Community Healthcare Association. If you enjoyed this episode and you'd like to help support Common Health, I encourage you to hit the subscribe button, share it with others on social media, leave a rating and review, or visit our website at www.vcha.org. This is Tracy Douglas Wheeler. Thanks again, and I'll see you next time.